Hi guys, welcome to MedNuggets channel. Today we are going to see about syphilis, which is the urinary tract infection caused by Treponema pallidum. Now let's see the pathogenesis. The mode of transmission of the disease is either by venereal mode, which is by sexual mode, known as venereal syphilis, or else it can be non-venereal, which is by direct contact, blood transfusion, or else it can be transplacental transmission. Now, let's see the spread of the disease. From minute abrasions, it reaches to the lymphatics and blood, thereby causing metastatic foci before causing any primary lesions. Now, let's see the clinical manifestations. Syphilis is also known as the Great Pretender. There are many stages of syphilis, starting off with the primary syphilis, which is the first stage in syphilis. Causes primary chancre, which is painless hard indurated ulcer covered by thick exudate. And next, regional lymphadenopathy, which is painless, firm, and it will be bilateral. Next stage is secondary syphilis. There you can see skin rashes over palm and sole and condylomata, and you can see mucus patches and generalized lymphadenopathy. And then the next stage is latent syphilis. In latent syphilis stage, there will be absence of clinical manifestation. Then you can know the fate, how the disease progresses. It can be persistent lifelong infection also, or else it can develop into late syphilis, or else there will be spontaneous cure. Now let's see late or tertiary syphilis. There will be gamma, which is known as late benign syphilis. There will be destructive granulomatous lesions affecting bone and skin. Next, neurosyphilis causing chronic meningitis, vasculitis and tabes dorsalis. Then cardiovascular syphilis, aneurysm of aorta, and there can also be congenital syphilis from mother to fetus. Now let's see the laboratory diagnosis of syphilis. Starting off with the direct microscopy, it is used for the demonstration of treponemics from primary lesions of primary, secondary and congenital syphilis. Then we are going to do dark ground microscopy by examining the wet film of specimen under phase contact microscope or dark ground microscope. In dark ground microscope, it will be slender, flexible and spirally coiled bacilli with tapering ends. Whereas in phase contact microscope, it appears distinct, sharply outlined, apple green, fluorescent colored bacilli. Now let's see for motility. There are different types of motility shown. The one is slow to rapid flexion extension type of movement, and the other corkscrew motility, and the next is rotation occupied by soft bending. Then we can also do silver impregnation staining, which is used to increase the thickness. Treponemics reduce the silver nitrate to metallic silver deposited on the surface. We can use Levandati stain and Fontana stains. Now let's move on to culture, which is non-cultivable but it can be maintained in rabbit testis. Now let's do the serological test. There are two types of tests. One is non-treponemal test and the other is but non-treponemal test is also known as lipoidal test, and the other is treponemal test. But in non-treponemal test, we detect only non-specific reagent antibody by using cardiolipin antigen. Whereas in treponemal test, we use treponemal pallidum specific antigen. And different tests of non-treponemal are VDRL test, toluidine red unheated serum test, and unheated serum reagent test, and rapid plasma reagent test. And in treponemal test, there is treponemum pallidum immobilization test, treponemum pallidum agglutination test, and treponema pallidum heme agglutination test. Now let's see about VDRL test. VDRL, which means Venereal Disease Research Laboratory Test. The principle used here is precipitation by slide flocculation test, and it detects the CSF antibodies. Then we only by VDRL we can detect the CSF antibodies. And advantages of non-troponemal test: it is used to monitor the response to treatment, and disadvantages are it can show biological false positive or else prozone phenomenon. Thank you guys for your support. I think so I have made syphilis simplified. If you like the video, please do like, comment and subscribe.